What is the history of lung cancer needle biopsies? Imagine peering into the past to see how doctors first learned to look inside the lungs without surgery. The story of lung cancer needle biopsies begins over 140 years ago, in the late 1800s. The earliest documented use of a technique called transthoracic needle aspiration happened around 1883. Back then, doctors used a simple needle inserted through the chest wall to try and get tissue from lung lesions. It was a rough start, but it opened the door to less invasive ways to diagnose lung problems. As time went on, technology improved. Early on, imaging guidance was limited to fluoroscopy, which is like a moving X-ray that shows the needle in real time. This method helped doctors see where they were placing the needle but had its limits. Then came a game changer: computed tomography or CORT scanning. With CORT, doctors could see detailed images of the lungs in slices, making it much easier to target small nodules precisely. This leap in imaging technology increased the success rate of biopsies from around 77% to nearly 97%, making diagnoses more accurate and safer. Further advances included helical CORT scans and CORT fluoroscopy, which allowed even more precise needle placement. These improvements meant fewer invasive procedures like open surgeries or bronchoscopies, which can be more risky and requiring longer recovery times. Alongside imaging, pathology techniques also advanced. Microscopic examination of cells and tissue samples became more detailed, especially with the rise of molecular testing. This is crucial today because it helps identify specific genetic markers in lung cancer, guiding personalized treatments. Today, there are two main types of needle biopsies used. Fine needle aspiration biopsy uses a very thin needle to extract cells, which is quick and minimally invasive. Core needle biopsy uses a larger needle with a cutting edge to remove a small piece of tissue, providing more detail for diagnosis. Both methods produce samples suitable for histology and molecular testing, which are essential for planning effective treatment. Safety has always been a priority. Techniques like manual compression after the biopsy, special devices to seal the biopsy tract, and methods to reduce complications such as collapsed lungs have made the procedure safer over time. These innovations have helped patients recover faster and with fewer risks. In summary, lung cancer needle biopsies have a rich history that stretches back over 140 years. From simple needle insertions to sophisticated image-guided procedures, they have become a vital part of diagnosing and managing lung cancer. The ongoing improvements in imaging, pathology, and safety continue to make these biopsies more accurate, less invasive, and more helpful for patients. Always remember, if you or a loved one need a biopsy, consult with healthcare professionals to understand the best options for your specific situation.